Okay, good morning and welcome everyone. Before we get started, let's be sure that everyone is able to select their language channel. The options available for this session are English, Spanish, or original audio, if you would like to hear the audio without any interpretation. For people connecting through a computer, you can choose your language channel by clicking on the interpretation icon to the bottom left that looks like a globe. For people connecting with a mobile device, you can choose your language channel by selecting the More option, then Interpretation, then selecting your language from the available options. We extend much gratitude to our interpreters today. We also have live captioning available that can be accessed by clicking on the Multimedia Viewer box on the right of your screen. Okay, and going to take a moment to share my slides. I would now like to welcome you to our webinar in honor of Domestic Violence Awareness Month, New Resources for Supporting Survivors at the Intersections of Mental Health and Substance Use. My name is Amanda Lyon. I use she, they pronouns, and I am a training and technical assistance specialist with the National Center on Domestic Violence, Trauma, and Mental Health. Now for some troubleshooting tips about this platform. If you get disconnected from today's session at any point, please re-enter the session using the original webinar link that was emailed to you. If the sound is unclear, it's likely due to an unstable internet connection. If this happens to you, feel free to call in for a better audio connection. If you are experiencing technical difficulties, you can directly chat with Carla Alegria, also with the Center for Assistance. If you are unable to contact Carla, please reach out to WebEx Tech for support. Carla will post that phone number in the chat box. We welcome you to use the chat feature to share thoughts, questions, and resources throughout the session. Your screen may look a little different depending on what kind of device you are using, but usually the chat box can be found at the bottom right of the screen. You may have to click on the chat icon that looks like a speech bubble to open it. Let's test the chat feature now. Please introduce yourself in the chat. Let us know where you're joining us from today. And if you'd like, you could also let us know which organization you are with. Just giving it a moment to see some of your responses coming through. So nice to see people from all over. Wonderful. Well, I'm excited to have your responses continue coming in. Let's see. Our center is headquartered in Chicago, the unceded homelands of the Council of the Three Fires, the Odawa, Ojibwe, and Potawatomi nations. I am honored to be living and working on the traditional unceded land of the Alutiiq Chugach, Sugpiaq, and possibly other inhabitants. Our local tribal organization is Katuchik and serves people from diverse cultures, including Inupiat, Athabascan, Aleut, and Alutiiq, who continue their subsistence practices, cultural traditions, and speak their language. We invite each person here to learn more about the land you are connected to. And one resource to get started is the website native-land.ca. Again, that's native-land.ca. The National Center on Domestic Violence, Trauma, and Mental Health is a special issue resource center offering training and technical assistance, research and evaluation, policy development and analysis, and increasing public awareness on the intersections of domestic violence, trauma, substance use, and mental health. The illustration on the right shows the key perspectives within our framework. The outside ring shows our overarching philosophies. These inform our core principles in the inner circle, which guide our work with survivors. When woven together, these perspectives and principles provide an integrated approach for working with survivors and their families. All contribute to ensuring programs are welcoming, inclusive, and accessible. These two graphics demonstrate how commonly domestic violence intersects with women seeking treatment for mental health or substance use. We see up to 60% of women in psychiatric emergency room situations and up to 90% of women in substance use treatment reporting experiences of domestic violence. At the same time, we know that these numbers are artificially low. A couple of reasons for this is that sharing about experiences of domestic violence can increase risk or danger for survivors, and services for mental health and substance use are not always accessible for survivors. So in reality, these numbers are much higher. Given these intersections, we would expect services to be accessible to survivors and to understand their unique needs. What do you think? Please share in the chat about what you have seen for survivors who are seeking support for their mental health and substance use. And again, I'll repeat that. If you would, please share in the chat what you have seen for survivors who are seeking support for their mental health and substance use. Are services accessible, and do services understand their unique needs? Let's see. I'll expand my chat. Give it a moment. Or if anybody would like to unmute and comment about what you're seeing with survivors trying to access mental health and substance use, that's fine as well. They have that capacity. I see a comment here that you lack resources in your area, but hired a substance abuse counselor for your shelter. I see a question about different studies. Yes, different studies will show have different results. The results are varying in studies, so it's up to 90%. We have it's difficult to find providers accepting new clients in our area. Definitely heard that a lot. For shelter residents who are only here temporarily, it can be difficult to establish ongoing support. Absolutely. And we see a lack of support from the abusive partner, making it difficult for them to get treatment. And someone says, Kylie says, you do not see support, you see stigma and a lot of blaming for the survivor. But your shelter has some programs, very excited, wonderful. Challenges with housing for people who are using substances and have mental health diagnosis. Absolutely. Limited resources in the area. Oh, and thank you, Gabriella, for responding more completely to Jennifer. Gabriella also works for the center and has been a wonderful part of this project as well. Extensive wait lists and providers not understanding domestic violence. So interesting, I think we see is that there are a lot of challenges that exist. Some bright spots, some progress, but there's definitely a lot of challenges with actually having people address these intersections. Great. Thank you so much, everyone, for sharing. I really appreciate seeing your responses. Let's see. Sorry, I have to move my chat around. There we go. Okay, so the work and resources that I'm going to be presenting today are part of the Survivor Health Connections Training and Technical Assistance Consortium, which includes the National Health Resource Center on Domestic Violence, hosted by Futures Without Violence, and the National Domestic Violence Hotline. Previous work of the consortium included supporting survivors to have better access to healthcare services through the development of collaboration and partnerships between domestic violence and healthcare organizations. I've included in this PowerPoint links to some of their work. The first is IPV Help. This site has many materials to support partnerships between healthcare providers and domestic violence advocates. Healthcare IPV and Health Centers is the hotline's resource and information center about healthcare. And finally, findahealthcenter.hrsa.gov is a searchable directory of all HRSA-funded health centers where services are offered regardless of a person's ability to pay. Health centers must offer at least short-term support and referrals for behavioral health as well. This website is a great resource for helping survivors find accessible healthcare services, especially in rural areas. And this has been integrated into the services of the national hotline as well. In 2022, the consortium expanded to include the National Center on Domestic Violence, Trauma, and Mental Health, with an increased focus on mental health and substance use. I've been working on this project for the past year. Some of the products in this presentation have been part of the center's previous work, but we have added several new resources as part of this project. Survivor Health Connections aims to increase seamless access to desired resources that support survivor safety and well-being based on their self-defined goals. In the fall of 2022, the National Center conducted listening sessions and a survey which gathered responses from advocates, survivors, and behavioral health providers to gain insight about the barrier survivors experience to accessing behavioral health services. We also completed consultations with culturally specific experts in the field for more information about helpful strategies to address these barriers. New resources were developed and are still in development based on the responses from these assessments. Quotes from the listening sessions and survey are included throughout this presentation, illustrating the reported needs. Please note, quotes may have been edited for length or clarity. You can check out a summary of findings from our listening sessions and survey in the linked document, Accessibility and Effectiveness of Behavioral Health Services for Survivors of Domestic Violence, a summary of survey and listening session results. Our resources are divided into 4 main categories, which we will look at individually. The first is locating behavioral health and domestic violence resources. The second is supporting survivors to reach desired resources. The third is supporting organizational collaboration. And the fourth is increasing accessibility for survivors. One area of need that was identified was helping survivors to find services that are actually available. As some of you also mentioned in the chat, many services have these long waiting lists. So, quote, sometimes it is a 3 or 4 week wait for them to be seen for the intake appointment, and then up to another 2 to 3 weeks to get the first appointment with a therapist. When our clients wait that long, many do not follow through with the therapy they truly need. I've even had multiple clients voice the fact that this made them feel like they did not matter and weren't going to get anything useful when the providers didn't care enough to understand the severity of their trauma. The need for culturally specific services was also regularly identified. as well as a need to understand and address the complexities of survivors' lives. Quote, leaving the relationship may mean leaving the only community that I know, the school system for kids, the faith community. It could include losing a mother-in-law who watches children while I go to work and I can't afford a sitter. Shelters don't always work for people with complex family and immigration issues and are traditionally set up for white populations. There's also a need for normalizing collaboration between behavioral health and domestic violence organizations to better serve survivors. Substance use, mental health, and domestic violence and sexual assault go hand in hand. You cannot treat one without addressing the other. Working together will lighten their load. Behavioral health providers do not have to be experts in other fields. They can have experts in their community that are happy to help. Service integration is imperative to long-term recovery. This first set of tip sheets are designed to simply help survivors, providers, and advocates locate services when they are requested by survivors. Locating mental health support resources includes several directories of therapists, including culturally specific directories, peer support resources, and mental health crisis hotlines and support warm lines. Locating substance use support resources includes options for locating treatment as well as harm reduction, CAT, harm reduction, mutual aid support groups, recovery community organizations, and substance use helplines and support warm lines. Locating domestic violence and sexual assault advocacy resources includes national domestic violence advocacy helplines, as well as domestic violence and sexual assault coalition, program, and resource directories. Locating mental health and substance use resources is coming soon in Spanish, adapted for Latin folks in collaboration with Esperanza United. Just one moment. Thank you for waiting. Persistent cats, we all have them sometimes. There's also two additional resources. There's the findahealthcenter.hrsa.gov that I already previously mentioned, and a newer resource is findsupport.gov, which provides information and connections to support resources for mental health and substance use that's in a really user-friendly format. Beyond locating services, we also value supporting survivor self-determination and deciding what services they wish to engage with and how. And quote, we recognize that sometimes clients are not ready for some services, and sometimes we find other outlets so they can still connect with people and process. Here are some new tools that can be shared with survivors that they may wish to discuss with an advocate or another trusted person in their life. The first is, do I want to see a therapist? This is a reflection tool for survivors who want to seek mental health support but may have questions or reservations. This includes questions to ask a therapist before an appointment, getting ready for an appointment, and questions for reflection after an appointment to help determine if the therapist was a good fit. Getting ready to change my substance use is another reflection tool for survivors. who want to make a change to their substance use. This tool includes information about many different potential pathways to recovery, including a range of abstinence from substances, harm reduction, non-traditional or cultural support, and others, so that a survivor can choose a pathway or combination of pathways that best meet their self-defined needs and goals. Understanding the dynamics of mental health and substance use coercion for survivors of domestic violence is important for both providers and advocates. The Mental Health and Substance Use Coercion Toolkit was developed in 2018 and provides foundational information for addressing mental health and substance use coercion in a variety of settings to help services be more effective in meeting survivor needs. This new resource, Key Elements for Responding to Mental Health and Substance Use Coercion in Clinical Practices, is a companion to the Mental Health and Substance Use Coercion Toolkit. The Key Elements document is an organizational self-assessment tool to support organizations in implementing or improving implementation of policy and practice to better support survivors experiencing mental health or substance use coercion. And I'd like to check in with everyone here for a moment. Based on your experiences, how do staff in your organization or other community organizations respond to and support survivors of domestic violence who are also experiencing mental health or substance use coercion? I'm curious if you have a level of comfort or if you've seen anything positive that organizations are using or that your organization is using in that response to mental health or substance use coercion. I'll give us a minute to think about that. Let's see, having clinical social workers on site, maybe not having any connection. We are hoping that, sharing these resources also will encourage advocates and domestic violence organizations to share this information with the other organizations in their area. Let's see. And you have another organization has LMSWs on site who are familiar, supportive staff, counselors, relationships with other agencies, advocates with lived experience. So it's great to hear that your organizations are thinking about these issues, making these connections with organizations. Right, and advocates are feeling comfortable with coercion and discussing mental health issues. So wonderful. Thank you everyone for sharing. These mental health and substance use coercion palm cards that are pictured were developed for use by behavioral health providers to improve conversations around mental health and substance use coercion. These cards include conversation prompts and suggestions for offering support so that survivors can connect with desired services. They are in easily printable format, so they can be portable. The concepts used in these cards are introduced in the Mental Health and Substance Use Coercion Toolkit. Online training modules for using the palm cards are coming soon. As you can see, both palm cards are currently available in English and Spanish. They are also coming soon translated into French, as well as being culturally adapted for Asian populations in collaboration with the Asian Pacific Institute on Gender-Based Violence, with translations in Korean, Hindi, Chinese, and Tagalog, as well as being adapted for Muslim populations in collaboration with Peaceful Families Project, with translations in Arabic and Urdu. We've also made versions of the mental health and substance use coercion palm cards for use by advocates, which have slightly different conversation prompts. Additional translations of palm cards will be made soon in partnership again with Peaceful Families Project, Esperanza United, and the Asian Pacific Institute on Gender-Based Violence. We are also developing a guide for advocates called Supporting a Survivor Trying Out a New Mental Health or Substance Use Resource, which could be used as a companion to the palm cards and reflection tools for survivors. Another theme that commonly came up in the listening sessions and survey results was the need for organizational collaboration between domestic violence, sexual assault, mental health, and substance use services. Quote, people go into service providers waiting to be told that they are not welcome and need to leave. They feel as if they are stepping outside of their own worlds. There is a need for collaboration to bridge the gap to help. Collaboration can build confidence for the survivor to accept the information they receive and believe that the provider understands the complexities of their lives and decision-making processes. We have developed 3 guidance documents: collaborating with substance use resources, collaborating with mental health resources, and collaborating with domestic violence programs. These documents describe the range of partnerships from being informed about the intersections of domestic violence, mental health, and substance use, to developing collaboration and creating integrated programs with interdisciplinary teams. Again, I'd like to hear from you. Please share in the chat, how does your organization collaborate with other services? Some examples might be cross-training, having a referral partnership, co-facilitating groups, having co-located services, or interdisciplinary teams. So again, if you wouldn't mind sharing in the chat, how does your organization collaborate with other services? Again, thank you, Gabriella, for responding to things in the chat for me. Let's see, some partnerships, being part of community coalitions, fantastic. Collaborating with the tribal mental health services, CBOs, community-based organizations. Fantastic. Monthly meetings, really important. Social work programs do not always include a lot of information on domestic violence. And yeah, so it's very important for anyone going into the professional field to really understand what survivors are facing and their complexities in their lives. Let's see, they're working on some coordination for coordination of housing. Fantastic. Oh, I love seeing all these different types of collaboration. Having referrals, mini clinics. Oh, I love that. Having mini clinics, fantastic. Inviting organizations to attend staff meetings and give presentations. Fantastic. And presenting to others. Thank you all so much for sharing. Another big area of concern for survivors seeking mental health or substance use services is confidentiality. I'm sure many of you would agree with this. Quote, I respect survivors by assuring them of protecting their confidentiality and letting them know that nobody will discriminate them or judge them. So our new resource, Confidentiality for Survivors Across Services, describes the importance of confidentiality for survivors, how to effectively communicate confidentiality, the importance of confidentiality in translation services and documentation, how or when to share information, a brief overview of federal confidentiality regulations, and discussion questions for advocates and providers to better understand the differences in confidentiality practices between organizations so they can better support survivor safety. A companion document is Protecting Survivor Confidentiality, Best Practices in Documentation, which describes best practices in informed consent and how to use documentation to enhance survivor well-being. Survivors and advocates also express that when services are not accessible or culturally responsive, survivors have experienced harm or feel uncomfortable with services. Quote, due to the past experiences people have had with mental health care providers, like unfair treatments due to their race, they tend to become uncomfortable visiting healthcare workers. Culture can influence how people describe and feel about their symptoms. It can affect whether someone chooses to recognize and talk only about physical symptoms, only emotional symptoms, or both. Next quote. Providers need to be culturally competent and responsive, practice cultural humility, understand their community, understand that cultural norms don't always translate into individual experience, and tailor therapy and treatment to meet individual needs. The new product, Integrating Cultural Responsiveness for Survivors Across Services, is still in progress and is designed to support providers in learning more about their communities and accessing the support needed to better serve the unique needs of their communities. The Guide for Emotional Support by Kathy Cave includes recommendations for protecting survivors from mental health stigma and discrimination, a conversation guide to talk about emotions, and a template to create a self-directed emotional support plan. This tool can help a survivor describe the support they need from advocates or other staff when they are experiencing emotional distress or other responses to trauma. Increasing accessibility for within LGBTQIA2S plus services. Quote, more survivors are seeking out mental health service providers who identify as LGBTQ plus. It is important for advocates to have a relationship with local LGBTQ plus resources, cross-train, and have someone you can directly refer to. Supporting LGBTQIA2S plus survivors was developed in partnership with the National LGBTQ Institute on Intimate Partner Violence to improve care across domestic violence, mental health, and substance use services. This tip sheet emphasizes understanding sexual orientation and gender terminology, collaboration with LGBTQIA2S plus community resources. It includes a brief organizational evaluation to support organizations in creating a welcoming environment. It includes specific practice considerations and capacity building resources. Quote, there are not enough therapists who speak the language, represent the community where the client is coming from, or understand the cultural nuances of where the client is from. Many advocates describe challenges for survivors accessing healthcare and behavioral health services in their language of choice. Language justice for survivors across services describes the importance of meaningful access to a survivor's language of choice, federal language access protections, working with interpretation services, trauma-informed resources for interpreters, and capacity-building resources for domestic violence, mental health, and substance use organizations. Language justice is just one aspect of cultural responsiveness. It is also important to have staff members who represent your community. You can also check out Tools for Transformation, Becoming Accessible, Culturally Responsive, and Trauma-Informed Organizations, an organizational reflection toolkit, and the accompanying implementation support guides for more information about organizational transformation. And again, I'd like to hear from you. You could take a moment and respond in the chat. What kinds of opportunities does your organization provide for staff who have lived experience and expertise as survivors or community members? So again, what kinds of opportunities does your organization provide for staff who have lived experience and expertise as survivors and community members? Trauma-informed group, EAP, employee assistance programs. I'm curious if there are any organizations that reserve a place for survivors on their board of directors or in leadership positions. The survivor on a board. It's fantastic. Having advocates who are survivors, reserving leadership positions, more trauma-informed training. Has to be as being considered expertise in hiring practices. Fantastic. I think it's really important to look at our organizations and how our staff members really do represent the community, and recognizing experiences of being a survivor as experience, as expertise. Fantastic. Thank you for responding again. So looking at spirituality, quote, service providers need to understand the intersectionality of faith, where people fall on the spectrum of religion, and meet them where they are. Many women who come to our shelter need validation from a faith leader. The Supporting Spiritual Strength for Survivors tip sheet is in development and will include resources for advocates and providers to work with survivors who may have a spiritual belief or practice that differs from their own, resources for engagement with spiritual leaders in your community, and identifying possibilities for empowerment through spirituality. The Faith and Spirituality in Trauma Resilience, Recovery, and Healing Toolkit by Gabriela Zapata Alma was developed to support advocates and programs to improve accessibility and cultural responsiveness for survivors who identify faith or spirituality as a source of support or struggle, and to understand how spirituality can support trauma resilience, recovery, and healing. This toolkit also includes several scenarios that you can work through to think about how does spirituality support a survivor's journey potentially. I want to thank you all so much for watching this presentation so far, and I'm really looking forward to our upcoming discussion. But I wanted to end this portion with a quote. I know that for a fact, people have a lot of stories to tell, but they can only do this if we are ready to listen to them. And I think a good part of taking care of these people is to actually listen. Please note that this project is not over. It is still in development, so we are still developing new resources. We'll be adding to the website throughout the next year. And I hope that these resources ultimately support building relationships with survivors by being prepared to meet them where they're at in all of these areas we have covered so far. Knowing your resources and how to connect with resources, collaborate with the resources and services in your area, building capacity to address the unique needs of survivors, but mostly remembering to listen to their voices, acknowledging them as the experts of their own lives and experiences. You can access the new collection of resources at this link. It will also be added to the chat. And let me ask one question on this slide. I'm curious if, as we've gone through all of these resources, was there a resource or resources that could be particularly useful to you or your organization? Potentially. I know you haven't actually seen them, but based on the description, is there anything that might be particularly useful for you? Toolkit, cards, fantastic. Collaboration, toolkits. Yeah, I love sharing some other ideas. If there's anything that you would like to see developed, feel free to make a suggestion too. As I said, we're still in development, creating new resources. Great. I also want to invite you to check out our full collection of resources on our website, which is listed here, www.ncdvtmh.org. And again, my name is Amanda Lyon. Is my email address if you wanted to reach out, if you have any questions or wanted to follow up on any of these topics. You can connect with the National Center through our newsletter or through social media. We have lots of resources. Let's see, and I'm going to, stop sharing. And with our remaining time, I would love to hear again from you if anybody has any questions, thoughts, or feedback. And I'm sorry, when I'm presenting, I'm not able to see the chat as well. So if there's anything that came up in the chat that you'd like to talk more about or did not get answered. Let's see, will you send a link? Okay, there's, Carla just posted the link for our new Survivor Health Connections website, which just went live today. I see a comment, restorative justice is hard to swallow. Would you like to say more about that? I'm not sure. Do people have the ability to unmute themselves? Okay. Sorry, just realizing you cannot unmute yourself.
No worries, Amanda. So this is Gabriella jumping in, and I just want to say, the comment around restorative justice was in response to an earlier comment that was asking for restorative justice for practices. And so something that I'll mention is that there are some really great restorative justice resources out there. And so we would be happy to recommend some of the great resources that have been developed in community by people impacted and that people are already using. It might be a little bit outside of our specific area of focus, being focused on mental health and substance use and those traumatic effects, but we are more than happy to point to the people who have been doing restorative justice for years and make those recommendations.
Thank you, Gabriella, so much for following up. Sorry, I'm just taking a quick look at the chat. I am excited to spend some time reviewing your comments. See, Angela, again, let's see, looking at mental health, substance use, violence, trauma treatment for both survivors and perpetrator. So far, the National Center has not focused on treatment for perpetrators, but there are other organizations who are doing that work. We are more of a survivor-focused organization, but I appreciate that comment. At the same time, knowing that when survivors find healing, we are looking at how that can then break intergenerational cycles of violence. So knowing that as we work with survivors now, we are also healing into the future and for future generations. Let's see. And I'll see what we can do about adding some restorative justice resources to the resources that will come out. Anything out there to help guide and educate individuals in relationships with survivors? I'm not sure if I've seen anything for that specifically, but I don't know, Gabrielle, if you're able to respond.
Yeah, so I have seen some different books be recommended, particularly for being in intimate relationships and loving relationships with survivors of many different kinds of trauma, particularly childhood sexual abuse. And so knowing that intimate partner violence is many times only one of many kinds of harms that survivors have faced. I imagine that there would be a lot in those books that might be relevant. I don't have any specific book to recommend, but I have seen them talked about.
Thank you. Yeah, that completely makes sense. And of course, there would be levels of trauma that could be affecting a relationship. Absolutely. Let's see. And I have a question from Sandy about the recording. Um, and I can say that yes, within the next week or so, you'll all get a follow-up email. Oops. Sorry, I lost my notes about that. Follow-up email, which will have the link to the recording of the webinar, and you'll have a copy of the slides, and the slides do have active links to each resource. But like, as you know, you can also just access them by visiting our website. You'll also receive a certificate of attendance for your time today and a link to the webinar evaluation. And I believe Carla is also going to put the survey link in the chat. There it is. And if you wouldn't mind to please follow that survey and let us know how we did today. We would love to hear your feedback. And again, as I mentioned, you're welcome to reach out to me if you would like to follow up with anything or have any further questions. And I'd like to thank you all again. Thank you so much for attending. Thank you to our interpreters. Thank you to the team who's been supporting, making this happen. And yes, I'll stay on for a couple more minutes in case anybody has any final thoughts. Thank you. Thanks, everybody.